Operation Good Samaritan is the international outreach program for the Division of Plastic Surgery at Loma Linda University. And basically we have a threefold mission. And the first is to provide reconstructive surgery for individuals in developing countries who wouldn't be able to have that surgery if it wasn't for our teams. The second mission is to provide training for local physicians in the regions that we go to. And the third mission that makes us really very unique is to inspire our residents to a lifelong commitment of health, healing, and wholeness. So over the years, we've been to, I've lost track, I mean, it's more than 30 different locations. We've been to countries all over the world. And sometimes we've gone back to the same place, sometimes we've moved on. We see ourselves very much as a handmaiden to Adventist Health International and the university in terms of the locations that they need us to go to.
When I arrived at the airport, there was probably 10 people there that came in 3 cars to welcome me, and I was the only one that got off the airplane, and I knew everything was going to be fine at that point.
The reception that they gave it to us over there was phenomenal. We had a place to stay, a person to take care of us. We felt at home.
This hospital is in a rural area, surrounded with a lot of poor people. So I was happy to see that this Good Samaritan team came, because the majority, or I can say the 100% of the people that were assisted were our poor people that cannot afford to pay for a surgery in our hospital. So I saw one mother and a child both benefit from the surgeries. And I'm very happy because some of them, they will live with those problems without any treatment because they cannot afford to do it.
I think my big highlight case was being able to work with Dr. Sadev. He went with us. He was our global health faculty, surgical oncologist, retired.
He has committed to accompanying our third-year residents on their trip each year, and this year the trip to Malawi was his 3rd trip with us. And he wanted the opportunity to not only do surgeries, but to train, to be an educator, to have that opportunity to give to residents.
I primarily go with the surgical residents, usually the plastic surgery residents who have finished 2 years of general surgery. So usually they get 2 weeks off after that to go on international missions.
So Dr. Lara, about cases, he was like a father for us, or like just a good friend, and he definitely is a key person in that hospital.
And been there 8 years.
He's been there for 8 years. He's a true missionary.
Right.
I want to say that it has been a very interesting experience to have this surgical team coming from Loma Linda, which they have brought some very young doctors as well, and very experienced surgeon on the team, which has helped us to really to face many of the surgeries. This young lady has come a few weeks ago to see us for the first time. Her name is Margaret Bwingwani. We found her suffering from a large tumor in the neck, which we call it goiter. It's the thyroid gland that was enlarged, so huge that she even had difficulties in moving the neck. After investigation, what we noticed that this type of enlargement, it can be surgically removed.
So it's like a bent trachea. So when they try to put a tube down, it can be a problem visualizing what exactly we want in the larynx and where the trachea is. So it's up here. So this has pushed the trachea all the way over to that side.
It has been a very challenging operation because it was quite huge tumor in the thyroid gland. So fortunately we managed to remove it, and she has been recovering from the operation very successfully. Now she has this bandage which we're going to remove now. Pepanimai, hipoteca pamono, pepa. Okay. You're going to see now just the scar, which we have been left there. Some of the clamps, we call it skin staples, which are those. That's the only mark now remains there. The mass was compressing the trachea. So after removing the tumor, the goiter, there has been already released that compression. Now it's already now feeling better because they can breathe much better.
I mean, with the resources that we have available
The
to us are
resources.
definitely different than what we have.
It really worked out pretty smoothly for what we lacked. If the doctor would ask for something, and if we didn't have one instrument or supply that the doctors needed, we would see what we had that was close to that. I mean, and that's what they do there on a daily basis. What they don't have, they have to improvise or the procedures aren't done.
And it's really very satisfying to watch our residents get a little independence and see things which they normally don't see back home. In Malawi, we have all these instruments which are reused. They're soaked in Sidex, and we will wash it off and we reuse it. The syringes we will never reuse in the US. But in this situation here, we have to reuse these things as needed. Here you make a schedule, and when you come in the morning, half the patients don't show up for surgery.
We were there at 7:30, ready to go, and by the time staff got ready, it was 9:30.
And you just don't know where you're going to go because the patient who didn't show up the first day show up on the third day, and so you try to do the best you can. I did about 19 cases with Lonnie Young and Dr. Machado. And Dr. Machado and Dr. Lara did another about 20, 21 cases. So we did about 40 to 41 cases.
We did several cases from minor to major operations, from large goiters, breast cancer, tumors on the head, tumors on the neck. I have not only had the opportunity to talk and have chats about patients, about discussion about management, about the care, and has already also helped me to refresh some of the new or latest technologies concerning treatments and management of patients.
The surprise is when they come back and I do a debriefing with them, every one of them over the years has said to me, I didn't know I could make such a difference. And that always surprises me that they would not kind of know. But it speaks to the fact that so many people don't really know what a huge impact they could make. Not just physicians, but people in all sorts of walks of life.
For me, it was a reminder of why I went into medicine and plastic surgery, and it's nice each step of the way along our training, having done things as a medical student and before medical school, and now having had some surgical training to go again, and I look forward to going again in a couple of years when we've had more plastic surgery experience. And to me, it's very reinforcing of what we should be doing.
I have always, thought about the opportunity to go overseas and help. In medical school, you always studies about, helping people go into a different country, and it's just for a dream come true. And the experience was so good that I want to go back, either to Malawi or any other hospital, just to help, because you can help a lot of people. The opportunity to help doing the surgery, talking to them after surgery, talking to the personnel involved in the hospital, all of that makes you just to broaden your mind and experience this to the most.